Good morning, everybody. My name is Ted Burton. I'm Vice President of Communications at Central Health. We're really happy that you joined us today for our community conversation on how businesses can partner with Central Health. I would ask that you please keep your mic muted until later when we have a chance to open up and ask questions. Today, you're going to learn about our procurement process, our plan to encourage diverse vendors to partner with Central Health, and upcoming opportunities to do business with our organization. Please know that Central Health is committed to inclusion and diversity throughout our organization, and specifically including contracting with historically underutilized businesses or hubs. But before we get down to the business of this community conversation, and I get to introduce my esteemed colleagues who are presenting today, we do have a few housekeeping items that we want to cover. For those of you who RSVP'd and were able to join us via Ring Central, our Zoom platform, either by video or phone, you'll be muted until about 12 when we will open it up for questions. If you're joining us by video, please feel free to drop a question in our chat box and we will answer them as we go during this conversation and during our question and answer time. We have a time set aside for the end. If you're joining us by phone and you have a question, when we open the lines, to unmute your line, you press *6 if you're on your phone. And in the spirit of inclusivity and to ensure that this meeting is efficient as possible and everybody has a voice, we really encourage you to ask just one question at a time. And then if we have time, we'll come back and allow for second questions so that everybody has a chance to participate. If we don't get to your question, we will collect all the questions that are asked and have our experts help answer them. And we'll send out all the questions and all the answers to everybody who participated today. We'll also use the mute button throughout the meeting to mute my dogs, for one thing. But also during the Q&A time, we'll mute everybody so that we can hear the person who's asking the question. And with that, if you're joining via Facebook, which we hope we have a large audience there, we will do our best to address your questions as well. But again, we're going to collect all of them, and then we will circulate them after this meeting is over with, within a day or so. Now, I would like to introduce my colleagues that will be presenting today. We have Lisa Owens, who is our Deputy Chief Financial Officer. Lisa, there you are. We have Belina Bunch, who is our Procurement Manager. Belina, there she is. And we have Rachel Taranjo, who is the owner, representative, and project manager for some very key projects that you are going to hear about today that we're working on in 2021. So now I will be quiet and I will turn this over to Lisa Owens, who will provide an overview of our procurement process at Central Health. Lisa?
Thanks, Ted. Good morning, everybody. We're very glad you're here. Thanks for joining us. I'm Lisa Owens, the Deputy CFO, and I look forward to talking with you this morning. I'm going to start by just providing a little bit of information about Central Health and our procurement process and our business partners. I first want to start by introducing our team. It's small enough that I can introduce them all. We have a wonderful procurement manager, you're going to hear from in a little bit, Belina Bunch, who works with Christina Irvin, our Senior Purchasing Analyst, and Scott Levine, our Purchasing Agent, and our Contracts Administration Manager, Carol Sacedo and Misty Salamero, who assists with all of our contracts, also make up part of our procurement team. So I just want to introduce everybody and let you know kind of the structure that we have. We do have a centralized email, purchasing@centralhealth.net, so if you ever need to reach us, that's the best way to go. So as a governmental entity, we do follow procurement policy in alignment with government best practices and purchasing procedures. And our purchasing policies include thresholds for formal and informal solicitations, as well as a good faith effort to engage historically underutilized businesses or hubs, or MWBEs referred to at times, And we, as Ted mentioned, have an initiative going to expand our outreach and work to do more extensive outreach through events like this, to share with people how to do business with us so that we can always be improving the participation of Hub in our contracts and our vendors. So at the highest level, as a healthcare district, our purchases are in the area of healthcare services, general business services, and commodities. And we do make a lot of purchases, which we'll talk about later, to support our clinical partners through purchases of medical equipment and construction services and for clinical space. We do primarily use an online platform called BidSync to alert, manage, and receive all of our formal solicitations. And we'll talk a little bit more about that and make sure you have the URL to get engaged there. That is our primary method of alerting people about upcoming solicitation opportunities. So last spring, we did share with our board an overview of our current and expanded ways of reaching historically underutilized businesses. It's an area we're always striving to continue to expand and grow. You can visit our website to read more about our annual Hub reports. We do share information about our expenditures with Hub vendors, as well as our board portal has all of our meetings online. And I think we're going to share in the chat and certainly in the follow-up the links to those as well. So we are trying to track better data and report more about how we're reaching all of our vendors, our Hub vendors, not just in the awards, but also are they receiving the proposals? Are Hub vendors submitting proposals in response to the solicitations, and then as a government entity, as most do, reporting on our expenditures. Another strong initiative that we're so excited about, was a great, I'm kind of still excited from last night. We had a presentation last night at our board meeting, and I'm hoping we can get the link somehow to just that presentation on our purchasing website about our disparity study. So as a government entity, we are in the process of conducting a disparity study. We engaged Collette Holt and Associates to conduct our very first disparity study. They are also conducting the disparity study with the city and the county. They'll be looking at our data from 2013 to 2019, and they will be analyzing that data and identifying any disparities. We have an independent website that Collette Holt and Associates is managing. It's an opportunity for any vendors, current or future, to feedback, or community members for that matter. And we really hope that people will give that feedback. This study will be going on all year, so there'll be lots of opportunity for that, and we will get the information out through social media channels and just general on the website as well. So you'll hear a lot about that over the next year from Central Health. I am going to hand it over to Belina Bunch now, our procurement manager, and she is going to talk a little bit more about specific ways that you can engage with us, as well as our current and upcoming solicitations. Belina? Mute. Unmute.
You're still muted, Belina.
Good morning.
I got to say it. You're on mute. It's the line of 2020 and 2021.
Good morning. I'm Belina Bunch, the procurement manager for Central Health, and I'm going to tell you about the different ways that you can do business with Central Health. There are multiple ways to do business with us. We have informal solicitations, which are used for purchases with an estimated dollar value of up to $50,000. The bids are unadvertised, they're unsealed, and awarded by purchasing personnel to the lowest responsible and responsive bidder that comply with the bid specifications. We also have formal solicitations, which include invitation for bid, request for proposals, and request for quotes. These solicitations are posted on the BidSync and Texas Comptroller's websites. Specifications and formal bidding documents are posted for a length of time that request pricing for specific goods or services. These bids are advertised in local newspapers and also on our Central Health website. What we currently have going on is we have a IT staffing services RFP that's listed on both websites. And upcoming solicitations include outreach services, translation services, consulting services, and staffing services for finance and administrative positions. We also have general business operations. We encourage our vendors that are interested in doing business with Central Health to register with BidSync or monitor the Texas Comptroller's Office website to ensure that you learn about all of our upcoming solicitations. Now I'll turn it over to Rachel Taranjo to tell you a little bit about the construction projects.
Thank you, Belina. Morning, everybody. I'm really excited to be here and be able to share what I think are very exciting projects coming up for Central Health. We have a lot going on in the world of construction right now. And again, I'm Rachel Taranjo. I'm the owner representative project manager overseeing the design and construction of some of our new clinic facilities. So just really high level, the primary projects we have coming up this year with Central Health is our Hornsby Bend Health and Wellness Center. That is about a 7,500 square foot facility with comprehensive primary care and telehealth services and some community spaces that we are in the process of designing right now to bring to the Hornsby Bend community in Eastern Travis County. We also have an Eastern Travis County project in the Del Valley community that is our Del Valley Health and Wellness Center. This is a clinic that we are expected to potentially build out to around 18,000 square feet that will house both comprehensive primary care and dental care services, as well as a drive-through retail pharmacy. So these are some really high-level concept renderings that our wonderful architects on these projects have put together for us as we are in the sort of concept design phase for both of those sites. We also have an opportunity with our operational partner, Community Care, who is in the process of designing a new health clinic on the Chalmers, Pathway Chalmers site with the Housing Authority of the City of Austin. That is a 5,000 square foot facility that we are building out to house both dental and comprehensive primary care services. So that will be a project that is a community care project, but we are facilitating with them this sort of design phase and helping them take that to construction. Next slide, please. Thank you. So just to give you all an idea and a little more insight into when we think we'll be going out to bid for the construction services on these projects, we have some just general timelines when we expect to go for bidding. We are in active design of all three of these projects. For the Community Care Chalmers, that will more than likely be the project that we go out to bid. Again, that will be bid out through Community Care. And we expect to go to bid for that project between April and May of this year. For our Hornsby Bend Health and Wellness Center, we expect the bidding to be, at least the bidding process to begin between this summer, really between June and August of this year. Some of that is contingent upon the permit and site plan review process with the City of Austin and Travis County. But expect the bid to be out this summer. Del Valley Health and Wellness is on a very similar timeline, and we expect the bidding for that project to be almost in alignment with the Hornsby Bend Center, perhaps a little bit longer window, looking to have the bidding process begin potentially between June and September of this year. And with that, I will turn it back over to Lisa. Thank you.
Actually, I can jump in. Thank you, Rachel and Belina and Lisa, for the presentation. Now, we actually moved pretty quickly. I do want to recognize that our CEO, Mike Giesland, is on the phone. He is joined. There he is. There's Mike. So I want to welcome him as well. And we are actually going to move into our Q&A session. Mike, do you have any comments you'd like to make before we open it up for questions?
Yes, actually, first of all, I just want to do a sound check. Can you hear me okay? Because I'm still audio by phone.
We can hear you.
Thank you. So I want to thank everybody for joining us today, and I want to thank everybody on the team for putting together this presentation. I think we have a lot of exciting opportunities as we think about how we can partner with the community, and the spirit of inclusivity, as Ted mentioned earlier. This is an important aspect of who we are as our culture as an organization. So thank you all for lending your time and talents. Thank you.
Thank you, Mike. And I probably should have started out the meeting by a quick explanation of who Central Health is and what we do. I did put something in the chat there, but in case you're not familiar with us, we are the healthcare district for Travis County, and we provide quality healthcare and coverage, access to healthcare and coverage to people with low income in Travis County. So people who are 200% of the federal poverty level or below. And we do that primarily through our medical access program, our MAP program. And so we work with a network of partners, clinics, hospitals, health organizations to provide access to a really robust set of services for our MAP members. And so you hear us talk about community care. They are affiliated with Central Health, and they are one of our clinical partners that we work with. So with that, we do want to invite you to ask questions. I'm going to monitor the chat, but if you're on the phone, you hit *6 to unmute yourself, or you can unmute yourself if you're joining us via Ring Central. And we're also monitoring the Facebook Live feed as well for questions. So with that, I will pause and see if anybody would like to ask our team any questions. You can raise your hand in the chat session also. This will be, there we go. Somebody's unmuted.
Hi, that was me. My name is Bobby Matt. Can you hear me?
I can. Thank you, Bobby, for joining us.
Okay. Hi, thank you guys for holding this session and providing more information on what Central Health is and how it assists the community and, low income. I've worked at Lone Star Circle of Care, so I'm kind of familiar with some of, the services that you guys help provide with MAP. And I do have a question. I know that you briefly spoke about, certain bids for construction and things like that, but where can we go? I'm with another company, Point of Care Health Services, and we do like COVID testing, and we're kind of new on the scene. So I'm wondering, where can we go to, if we're interested in becoming a healthcare partner? What is the process, or is there a certain link, or what does that look like?
Lisa, do you want to take that one?
I think, can I just clarify, are you asking about to help with vaccine and COVID testing and specifically, or just?
Yes.
Okay.
Yes, ma'am. So I'm partnered with a company now, a healthcare company that provides testing, and of course, once the vaccine more is allotted, that as well. But
okay.
And so we're interested in, finding out more information on how we can, become a partner and help serve some of the community that's most in need.
Okay, well, we can certainly get your information and try to be a connector. At this time, we're not soliciting for that service, but we are, and I see Mike and Ted work in the community on several work groups that are the network of vendors that are distributing, and certainly our partner Community Care, the clinic system. So we can help make that connection. I can certainly offer that. And Mike, do you want to add anything?
Yes, and we've heard from a number of people and groups, especially in the nonprofit arena, wanting to help with the outreach and the engagement aspect of this, because when you think about everything that's involved, there's a lot of different roles that a lot of different people can play, and so we're helping to make those connections, within the larger working groups. in this regard. And so that's something that we are absolutely happy to do. In fact, I've got a few emails I need to send later today from some people that I heard from yesterday to make sure that they're plugged in.
Okay, that sounds great.
Thank you, Bobby, for joining our conversation. I'm going to move to a couple of questions. Oh, I'm sorry. Go ahead.
Oh, so would I just follow up with someone to get the information, or do I need to just email someone my information?
You can email, everyone can email purchasing@centralhealth.net about business partnerships, and we'll forward it and reply to you and make sure we get you connected with the healthcare services team. So it's purchasing@centralhealth.net.
Awesome. Thank you, guys.
Thank you so much. I'm going to move to some of the questions in our chat. One question was already answered. It was a question from Nancy regarding vaccine distribution and is Central Health involved? We are not a vaccine distributor, but we are working on education and getting information out to the community about how to register a vaccine. We obviously work with Community Care. They are a vaccine provider and have been receiving a limited amount of vaccines so far in this process. I think the important thing to remember is that the vaccine supply is extremely limited. And so we are really focused on making sure that our MAP and MAP Basic members know how to register to get the vaccine. So if they're a Community Care patient or Lone Star or People's, they'll be contacted as when it's their group's turn, the guidelines that are set forth by DSHS, the state, and the federal government. And so our Central Health's piece is really on education, awareness, and getting folks registered and basically queued up for the vaccine when it's their turn. And we are working on an incentive plan to actually pay our clinical partners to vaccinate MAP and MAP members. And that is answered in the chat. There is a question from Chris, and I'm going to turn this to our procurement team. Do you know if any design services, architectural, MEP, civil, structural, have been awarded for these 3 projects? So those are the projects, Rachel, that you were discussing. And also, will commissioning services be required for these projects?
Yeah, Ted, thank you. And thank you, Chris, for asking that question. We have awarded the design services for these projects. So we have design services already for the architectural, as well as the civil and geotechnical engineering. And I believe you mentioned MEP and structural, which fall under our architectural services. So we have awarded those. We will be evaluating and more likely will award services for commissioning for our Del Valley Clinic.
Thank you, Rachel. Maxine has a question. Do you have opportunities for nonprofits to join the network? And she's with the Alzheimer's Association of Capital of Texas.
Sure. Yes, we work with nonprofits in many capacities, and we're interested in partnering. This would be similar to the question about the vaccines or COVID testing. If you will email us your contact information, we will connect you with the right department. I'm thinking our patient care management and our health services department about the services that are offered through the MAP program to our MAP patients, but also just our network of healthcare services. I think we got a similar question from Facebook about partnering with fitness groups. I would ask the same thing. If you could send us your contact information, we can navigate it to the right department, not only to raise awareness at the case management level so that all of our navigators, community health workers, and patient navigators are aware of referral opportunities, but also for partnerships that some of you are asking about. So please send us that information and we will connect you to the right department.
And Lisa, I would also add, when it comes to partnering, our communications and community engagement department also partners with a very diverse variety of nonprofits, organizations, faith-based organizations, apartment complexes, small businesses, We've been doing this during the COVID-19 pandemic to get information out to high-risk populations. So you can email me at ted.burton@centralhealth.net, and we can plug you into our community outreach and community engagement efforts as well. I want to move to some more questions. There was a question regarding partnering with other MWBE and hubs to respond to bids, and how can you do that? And that's definitely encouraged, and I'll let Lisa or maybe Belina take that one.
Yeah, I'll let Belina take that one. She can talk about the pre-proposal meeting.
So whenever we launch our solicitations, we have a pre-proposal meeting for every solicitation that we launch. That is listed on the schedule of events that's sent out with the advertisements. In the pre-proposal meeting, we ask all vendors to sign up via the chat so that we can have a list of everyone who attended. We also ask primary vendors to list if they are interested in subcontracting with subcontractors and hub contractors. And so we take that list and we publish it on BidSync as an amendment to the solicitation so that it's visible for everyone to see. Subcontractors can contact primary contractors to see if they're interested in partnering with them.
And Belina, as a follow-up question, somebody's asking, can a nonprofit partner with a for-profit in responding to a bid? And I believe the answer would be yes. I just thought,
Yes.
Okay.
We have no restrictions.
Looking for anybody have questions that they want to ask live, either phone or video? If not, we'll keep working our way down through the chat questions. Would anyone like to ask a question? If you're on the phone, you press star
There is
six.
a question, Ted, about our hub goals. It's a great question, kind of dovetails to the presentation we had last night.
Sorry if I missed that one.
That's okay, it just popped in. So at this point, Central Health does not have specific goals that you might see from the county and the city if you've proposed on any of those or any other government agency, because we have not conducted our first disparity study. So Chris, the answer is we don't know at this time. We don't have specific goals for hub participation, but that is something that is coming. At the end of the disparity study, we will be establishing goals in those different purchasing categories, such as construction, professional services. So we look forward to establishing that program later this year.
And Lisa, we will send out the link from last night's board meeting, the presentation on the disparity study. I'm not sure if it's ready to be posted yet, but as soon as it is, we will include that in the follow-up email.
Great, thanks.
Any other questions from our either folks that have joined us via video or on the phone? Press star 6. I'm continuing to look down at the chat for more questions, and we're also monitoring Facebook Live. Let's see, here's one. Here's a, it's not really, I don't think it's exactly a question, but somebody with Texas Health Steps talking about their mission of educating clients on how to use Texas Health Steps, Medicaid benefits, and assisting or choosing or selecting a medical or dental health plan. And they're available to do virtual group presentations, which is great to know. So thank you for sharing that information. Anybody else have any other questions? I'll ask one, I guess, Lisa or Belina. Belina, you mentioned several different procurement opportunities coming up. What is the next one that you expect to be released? And you're muted, actually. I've got to say that twice now in one meeting.
I'm so sorry.
No, you're fine.
Right now, we're working on outreach services for the communications department. And we will also be working on staffing services coming up as well for financial and administrative positions. Those are the two that come to mind immediately, but like next month is when we're looking at posting a couple of upcoming RFPs.
Great. Thank you. Are there any more questions from any of our guests? Any follow-up thoughts or comments? You can unmute yourself if you have a question, or *6 if you're on the phone. Okay. Well, I think we can wrap up a little early then if there are no more questions. I'm just checking one more source here. Yvonne or Anais, do we have any other questions?
No, there's nothing on Facebook. I think we've answered all of those.
Great. So
Ted,
we will.
can I say one other thing?
Please do.
Regarding informal solicitations, since we don't post those on BidSync, a great way for you to receive informal solicitations is also to register with the CMBL, Charlie Master. It's called the Central Bidding Masters List. And if you register with that, that's where we get our vendors who are registered, by your specialty. And we'll send a email out to those vendors for informal solicitation. So if you're not, we encourage you to register with BidSync, but also please register with the CMBL.
Can you, Melina, again explain what the difference between an informal solicitation and a formal solicitation is?
Sure. Informal solicitations have a dollar value of under $50,000. And so we take a very specific statement of work with specifications, and we send it out to vendors who identify with that specific category of work that we're looking for, specific type of work we're looking for. We send a statement of work and specifications out to them, and we ask them to submit a quote according to those specifications. If the vendor meets all specifications, there's nothing missing, we actually, and that deems them as responsible and responsive, then we award that solicitation to the lowest priced vendor. And so we gather those vendors from a couple of different lists. We look at BidSync, we look at the CMBL, we look at if it's a IT product that we're looking for, we'll go to the DIR, which is the Department of Information Resources. We'll go to that link and to that website, and we'll gather vendors from that website. So it's crucial, really, or it's beneficial, I should say, for vendors to register with all. If it's at all possible to register with all of those places, then you have a greater opportunity to see everything that comes from our organization and be able to bid accordingly.
Great. And we'll include this information also in the follow-up email. There is another question. I think the name is Kate or Katum. Are all vendor contracts direct to Central Health, or are the contracts with county, city, other? Today we're talking about Central Health, but do you want to?
We do, and Central Health does not contract vendors for the county, city, or other. We are specific to our enterprise, and we are Central Health, Community Care, Sendero Health Plans.
And I'll just add, Ted, as a piece for that question, there may be times, for example, in our construction projects, where we hire a construction manager. So the bid out for the subcontracts may come from them, but Central Health would participate in the evaluation and selection of those bids.
Good point.
So it may be a sense that contract is actually held with the construction manager, but we as Central Health are obviously involved in that bidding and that selection and that process.
Good point. I don't see any other questions in the chat. We don't have anybody with questions, so we can wrap it up.
Ted, on Facebook, Mia is asking to repeat what CMBO stands for.
It's CMBL, Central Bidders Master List.
Central Bidder.
BIDDER, Bidders Master List.
I had it wrong in the chat. Thank you.
It's this is David Duncan. It's maintained by the Comptroller's Office. I used to work for them. So
if anybody can grab the link,
it's the centralized master bidders list. It's on the Comptroller's website. And
we will also include that in a follow-up email. As I mentioned at the beginning, we will send out a follow-up email to everybody who joined today's meeting, and we are capturing the questions and we will answer them so that you'll have that. And we do want to thank you for joining us. We really appreciate the opportunity to do business with you and to talk a little bit more about our process, And our goal is to make doing business with Central Health as easy as possible, as clear as possible. And we have a really amazing team that's here to help. And so if we can answer questions, or if you have thoughts or needs, please don't hesitate to reach out to us. And with that, I don't know if Lisa, do you have anything, or Mike, that you would like to say before we wrap up? And we're going to be doing the same community conversation in Spanish beginning at 12:30. And so we'll take a little break and then reboot and begin the community conversation again. Lisa or Mike?
I just want to say thanks for everybody, to everybody for joining. And we are working hard to get more information out there on our website and through presentations like this. So thanks to our communications team for helping us facilitate. And please don't hesitate to reach out. We'll either connect you or look forward to helping you get engaged so that we can be partners in the future.
Ted, one thing, minor tweak, the Spanish community conversation will take place at 1 o'clock.
I apologize. Yeah, I'm sorry. Mike, did you have anything? Mike, you're muted.
Sound check. Can you hear me now?
We hear you now.
Okay, thank you. So again, I want to thank everybody on the Central Health team that has worked to pull all this together. As you can see, there's a bunch of really talented folks that are working on this. And for those of you that joined us today, yes, we've talked about business opportunities, but also I want to stress that this is hopefully an opportunity to partner, for years to come with an organization that is out in the community and making a difference in people's lives. And so it goes beyond just doing business, and it's really about a strong community-based partnership. And if there's other people that aren't on the call today that that would like to have some of this information, I know this is recorded. There's a lot of web links that we've provided. Pass our name along as a potential business partner too as well. I think this word of mouth and is part of bringing the community together. And so that's my humble ask. And again, I want to thank everybody for their time and talents today. Thank you.
Thank you, Mike. Thanks, everybody. I hope you'll bookmark our website, centralhealth.net, not just for procurement and business opportunities, but just to stay up to date on everything that Central Health is doing, whether it's our response to the COVID-19 pandemic or information about how to get enrolled in our medical access program. It is a robust clearinghouse of information regarding all things healthcare for Central Texas, Travis County. So please visit it frequently and reach out to us anytime with questions, comments, thoughts. We do consider you a valued partner, and we appreciate your time today. So with that, we will all wave goodbye and say goodbye, and we will see you next time. Thanks, everybody.
Bye-bye.